Okay, so tonight we're going to talk about medical emergencies in terms of this and the services that you should be considering to have in order to have your boat and you and your crew covered and prepared. As we were just talking before we started, we spend a lot of money on our boat. Uh, we need to spend a little bit of money on ourselves in terms of preparation. As Tim Metcalf said, we spend money on our InReach subscription, our Starlink subscription, uh, subscriptions to medical services can make the difference. It can make a life or death difference. And so I think the services tonight are ones that you really should consider. And tonight we've got, as I would describe it, four points of the compass covered. We're going to have as our first speaker, just give me a second as I'm letting a couple more people in, Dr. Adam Rudenberg, who is going to talk about GW Maritime Medical Access, which is the emergency room at sea, is the simplest way to put it. And following Dr. Rudenberg will be Dr. Benjamin Jack, who's the founder of Duration Health. And he's going to talk about the prescription plan that they can put together to give you the right drugs to have on your boat. And I can tell you, I didn't quite have the right stuff this year, so we made it through, but knowing that you have the right meds makes all the difference, and it makes the job of the folks at GW even a little bit easier. And by the way, I should mention that GW is a gold sponsor, and Duration Health is a silver sponsor. And a new silver sponsor to the Salty Dogs is Arno Crispel's International Medical Insurance, or International Insurance. And he's going to talk about the programs that he represents. And then in the worst case of all cases that you need to get home fast, you need a way to do that. And Tom Casey of MedJet is going to talk to us about that tonight. So please put all your questions in the chat as we move along, and we will at the end go back to the top of the chat box and answer all your questions. And with that, I'm going to turn the floor over to Dr. Rudenberg.
I need to unmute myself, but thank you very much for the introduction. I'm just going to share my screen here so that I can just show some slides. Just give a moment. Okay, I hope everyone can see this. So can everyone see it? Someone just give me a thumbs up. Do I
Yes,
see Thomas? Okay,
it's
perfect.
fine.
Thanks. Got it. Okay. So I'm an emergency physician at George Washington University in Washington, D.C. I'll just start and tell you just a little bit about myself. I'm a board certified emergency physician. I'm on the faculty at George Washington University Medical School and practice emergency medicine on a day-to-day basis in the emergency department, both at GW University Hospital and also our practice contracts with the government. And I also put in clinical time at the Washington, D.C. VA Medical Center as a practicing physician. And then I'm also a telemedicine physician. I've been doing this for many years. I'm the quality improvement director for our program, Maritime Medical Access. And I do like to throw a little plug in as well for myself. I am a tall ship sailor. Don't get out on the water nearly as much as I would like to, but I do like to show this is me up here on the yard here on the Kelmar-Nickel, which, if anybody knows, is the state tall ship of Delaware. So I think something that's important to know about us is that all of our physicians are in some way have expertise in either remote medicine or maritime medicine. GW Maritime Medical Access in particular is a program within the Department of Emergency Medicine at GW. It was founded in 1989, so we've been around for quite some time. We provide 24/7 access to really anywhere that there are remote individuals or people that don't have immediate access to medical care. So this started for the maritime industry. It used to be, it started off as a single doctor with a pager, and it's grown over the years. And now we have a dedicated group of physicians who provide 24/7 call coverage. We have a dedicated call center for this program and for other telemedicine programs. And we've really expanded over the years. We also provide medical telemedicine coverage for private jets in flight, and then also a lot of land-based worldwide remote locations. So research stations in Antarctica, things like that, places where people can't really get care. And we provide, basically medical, logistical and operational support, but chiefly medical support. We're connected to George Washington University, and as I said, we're part of the Department of Emergency Medicine here. So we're an academic emergency department. We were the 7th emergency medicine residency in the country. Our chairman is actually about to retire after 40 years, but he's been at GW since almost when I was born. We have a lot of experience with global education and medical experience. In addition to the telemedicine work that we do, we also do training around the world of various types. We support residencies in India. We travel for private clients to put classes on around the world. We live within what we call the Division of Innovative Practice. We have telemedicine and operational experience, but also we're backed up by over 50 medical specialties and subspecialties. So most of what we do is through the Department of Emergency Medicine, but at times we will consult with physicians in other specialties like orthopedics or dermatology or psychiatry as needed. So what is telemedicine? I think, probably everyone sort of knows the word telemedicine now, and this is not really a formal definition. There are formal definitions. Telemedicine is really, expanded over the last 4 years, 5 years, obviously with the pandemic. I think a lot of us probably have experience with telemedicine now. But I like to think of it as remote medical consultation. We can do it phone or face-to-face video. And actually, I don't have on here, but we can also do various text-based services and over email. And actually, a lot of the consultation that we do is over email because sometimes boats have very low bandwidth. Why? It's really to bring expertise out to you. So we, of course, we can't get you evacuated necessarily, although we can interface with organizations that can, and we can't bring equipment to you, which is where people like Dr. Ben Jack, who's on the call, come in. But what we can do is answer the phone at any hour of the day, take a history, find out what's going on, and based on the capabilities that you have on board, we can make recommendations for medication, wound care, really support you through any kind of a medical emergency, big or small, and where that can basically go to wherever you are. Now, I will say there's one caveat, which is that in the United States, a doctor has to be licensed in the state where the individual is. So often when people are in port, we may say, you may call us and we may say that if you're in port or near port, that your best option is to go ashore. Although that said, our group amongst our physicians, we do carry licenses in many states, many coastal states, in addition to Washington, D.C., where we're located. I mentioned that we have a worldwide emergency communication center, so we call this the WEC. It's sort of our nerve center. It's dedicated to this program and our other telemedicine programs. It's a communication and operations hub. We staff it with EMTs and paramedics. So if you email us or call us, you're going to have someone with some medical training who's going to take your initial intake, get some information about what's going on, and then loop one of our physicians on call on. We also maintain an operational database so that we know what cases we're managing at any one time, and then we have a HIPAA compliant medical record. And so our WEC operators or communication specialists, as we call them, they really help to facilitate the sharing of information, the tracking of information. And this is important from day to day. And the reason is that you don't just call us, ask for some advice, and then we hang up the phone and we're gone. If you call us, we keep a case open. I have a little flow chart here, but consultation is initiated by the boat, by the ship. Physician will join either by phone, or if it's an email, we'll respond with an email. We'll make a treatment plan. We'll review that treatment plan with you, provide advice, and then we'll follow up with you as needed. And if it's something simple, we may just do a follow up 2 days later. You're taking that antibiotic, your sore throat's getting better. That's great. And then upon resolution, we close the case. And resolution can mean that we've that the medical issue has been resolved, or that you have made it to shore and you've been transferred to a higher level of care if necessary. Sometimes there are things that are that may be outside the scope of emergency medicine. So emergency medicine, the motto of emergency medicine is any patient, anywhere, anytime, which is true. But at times, we may need some assistance from some of our colleagues in other specialties who have highly specialized knowledge. And so we have the option to consult with their medical specialties. And we generally have a rule that if we're going to recommend an evacuation or a diversion, we will always have at least a 2-physician conversation. A lot of our clients are large commercial companies that really have a big financial incentive. It costs them a lot of money to divert a cargo ship, for example. And so, we really like to balance the needs of our patients. We want to make sure that they're appropriately taken care of, but we also recognize that that diverting is sometimes not easy and evacuating is sometimes not easy. And so we always bring multiple physicians in if we're going to have that discussion. We don't facilitate evacuation, but at the request of the captain, we will interface with any Coast Guard or authority around the world. So there are situations where we've maybe recommended evacuation. The captain will call the Coast Guard and then they'll request a consultation with us so that we can sort of, hand off the case and explain what's going on. I do, just want to put a little plug out there, although my goal here really is to just sort of talk to you about our service and who we are and what we do. I do want to make the point to say that we're only as effective as our clients are prepared. So, we like to make sure that when people go to sea, they've seen their doctors, talked about the nature of their voyage, had a physical, they're up to date on vaccines. They've had appropriate lab work, EKGs, medications have been appropriately refilled, and that there's a medical history and summary for everyone on board. When a case is initiated with us, we sort of think of it as a typical doctor's office. And if you think about going to your doctor's office or a new doctor, they're always going to ask you, what other medical problems do you have? What medications do you take? And that is important for everyone on board to have, but it's also important for that to be accessible to anyone else on board, even if it's private, kept in a sealed envelope, because somebody may be unconscious, they may not be able to explain what their history is, and often the answer to what may be going on in a medical emergency may lie in their history. So that's important. We also see a surprising number of eye and dental complaints. So I always tell people, make sure you have an extra set of glasses, make sure that you're seeing a dentist twice a year. You get any, the last place you want to be when, your crown falls off or your bridge fractures is out at sea. And that's actually a surprising amount of our cases are dental. So we will be covering the rally this year. And then, I also want to mention that if anybody is interested in coverage outside the rally, you can certainly always email us. You can, I'll stay on for any questions that you might have. That was a pretty broad overview of our service, but you can email us at admin@gwmaritime.com. And that's it.
Okay, well, thank you very much. And by the way, I have to admit, I've used the service a number of times this year, and they've been very responsive, and the follow-up has been really superb. So thanks.
Sure.
But
Thanks.
I'll ask my question later. All right. So Dr. Ben Jack, you want to talk about Duration Health?
Yes, thank you. Happy to be here. Let me share my screen here. Okay. Can everybody see that? Great. So I'm Benjamin Jack. I'm an ER doctor, founder and CEO of Duration Health. I really like taking care of people who travel off grid and are away from typical access to medical care. And in 2019, I had this idea, could we put together prescription medical kits for people who are going out in the water, going out to sea, or really going off grid anywhere to help support them through any medical emergencies that might arise. And so I ended up creating Duration Health around that idea. We're the portable emergency room for off-grid living and travel. We're now the team athletes for the North Face Global Athlete Team. And we are backed by a fantastic group of physicians that I'm very lucky to work alongside of who actually facilitate this whole process. So The way that it works is you go online, you talk with one of our doctors before your trip, we review your medical history, we prescribe medications that you might need if you get sick, so that you have those on hand. And we work beautifully hand in hand with Dr. Rutenberg's group at GW. They provide the advice, we give you the physical medications that you need, and you have everything there ready to go. I also want to give a shout out to my colleague, Dr. Therese Malka, whose slides I'm stealing today. She's one of our maritime medical experts, but couldn't be here today. So thanks, Dr. Malka. So I'm going to run through a couple of general pointers, specifically what you need to know in terms of medical care for going out to sea. And then I'll return the last few minutes just to speak another moment about Duration Health. So a couple of things to think about: strains, sprains, cuts, and bruises. So for wound care, again, this is going to be first aid 101 here in 5 minutes. So if you have a wound, you want to irrigate the wound as much as possible, use drinkable water that's available. At sea or in the emergency department, we say that the volume and time and pressure of that fluid that you're putting on the wound is more important than whether it's sterile or not. Drinking water is just fine. Avoid hydrogen peroxide and alcohol and antiseptics, as those can be abrasive to exposed tissue. Bleeding, you want to keep firm, prolonged direct pressure on a wound. Don't peak, keep that constant pressure there for 20 to 30 minutes before releasing. After bleeding fluid, you can keep it moist, something like Aquaphor, Vaseline, or an antibiotic ointment, keeping it covered and clean. We talk a lot about being prepared with antibiotics, but most wounds do not need antibiotics. Again, even the emergency department, where we have ready access to them, we don't typically prescribe antibiotics for most clean wounds. However, if there's a contaminated wound, you might consider antibiotics. Again, especially if you have access to Dr. Rutenberg's group, they can advise you on that. And Cipro and levofloxacin are 2 antibiotics that we think about for water-contaminated wounds. So head injuries, red flag symptoms that you want to look out for: prolonged loss of consciousness, seizure, severe intractable headache, if a patient is somnolent or lethargic, repeated vomiting, disoriented. I think, those would raise anybody's red flag to see those. Orange flag, things that we worry about but don't necessarily indicate a severe head injury: a brief loss of consciousness, mild confusion, single episode of vomiting, or a moderate headache. And then, patients that are okay to observe, you're talking about a mild headache, some dizziness, nausea, irritability, and fatigue. And I'm going to sound like a broken record here, but again, when you have access to a service like GW MMA, they can continue to advise you if something happens. So moving on, I'm giving you all of medical school here in a few minutes. We'll talk about splinting. So if you have or suspect a broken bone, obviously you want to splint that to provide comfort and pain relief, to prevent further injury. And we say big, ugly, fat, and fluffy is a good way to make a splint. So you can fashion it out of material that you have, or if you have a dedicated first aid kit with something like a SAM splint that's pictured up in the corner there. Obviously, if you can bring one of those or a similar tool with you, that's a nice thing to have on hand. And if you don't, you want to use this as a mnemonic for fashioning a makeshift splint. Seasickness. So there are different categories of medications that we use to treat or prevent seasickness. Over-the-counter medicines that we use include meclizine, which is less drowsy Dramamine. There are actually 3 different types of Dramamine on the market: non-drowsy, less drowsy, and regular Dramamine. So less drowsy is meclizine. Dimenhydrinate is regular Dramamine. Ginger is that non-drowsy, or just obviously not a medication per se, but can be used to prevent seasickness. And then acupressure bands are another good non-pharmacologic option. For prescription, scopolamine patches, which is a patch that's worn behind the ear, can prevent seasickness. And then a medicine that we'll often reach for is ondansetron or Zofran, which we dispense as oral dissolving tablets. Those dissolve under the tongue and can make you feel better if you're nauseous or vomiting. Dehydration, so another common concern. Usually a regular diet and lots of fluids is enough to prevent dehydration. But if you're talking about situations with sunburn, windburn, some medications, certain medical conditions like diabetes are going to increase your risk. If somebody's not eating, then drink liquids, and plain water is usually not the best thing to rehydrate someone with. You want liquid that contains a glucose source and electrolytes. So something like oral rehydration solution, which there's a little recipe given for here. So better than water is dilute Gatorade, dilute apple juice, something like Pedialyte, or to make your own oral rehydration solution with the formula shown here. Eye irritation, infection. So again, splitting it into over-the-counter versus prescription options. Over the counter, we talk about allergy eye drops or natural tears, antihistamine eye drops. On the prescription side, there are both drops and ointments. For drops, we use something like ciprofloxacin drops for a corneal abrasion or a bacterial conjunctivitis. And then there's an antibiotic ointment called erythromycin that we'll often use, which can be used in a similar way. Swimmer's ear or otitis externa. So there's two kinds of ear infections, broadly speaking. There's a middle ear infection or otitis media. That's more often what little kids get. You think of a 2-year-old with a fever and ear pain, that's a middle ear infection that's often treated with oral antibiotics. In adults, it's much more common to get an outer ear infection or otitis externa after you go swimming. That's treated with an antibiotic ear drop. This kind of ear drying aid can prevent swimmer's ear. And if you develop swimmer's ear, it can be treated with an antibiotic eye drop, for example, or antibiotic ear drop, excuse me, for example, cortisporin, or some of the other drops that we include in our kits. Watch out for worsening of chronic conditions, asthma, GI issues, UTI, high blood pressure, diabetes. As Dr. Rutenberg said, a good idea to check with your primary doctor before you set out. So first aid kit. On the non-medication side, here's a list of items that you may want to include, and we will forward this along. Alex can send this out to the group rather than me reading it down here. I'll focus more on the medication. So on the prescription side, and this is one of our kits pictured here, we talked about scopolamine and ondansetron for nausea, antibiotics, something like cyclobenzaprine, which is for muscle relaxation, for pain and injury, an antibiotic eye ointment or drops, an antibiotic or steroid ear drops for that otitis externa, an oral steroid for something like more severe allergic reaction or dermatitis, prescription steroid cream, similarly. An EpiPen is a good thing to have on hand to treat anaphylaxis, a severe or life-threatening allergic reaction, and an albuterol inhaler for breathing problems, especially if you have a history of asthma. On the medical equipment side, things like an automated external defibrillator or AED, which we sell. That's kind of the ultimate piece of medical equipment, so to speak. If somebody suffers a cardiac arrest, that's the type of device that you would deliver a shock to the heart to restore a heartbeat. Again, it depends on the length of your voyage and where you're going, and what kind of situation or the medical history, particularly of the people that are going to be on board. We can advise you on all those factors as well if you come through and purchase a medical kit. And then we talked about some of these other items that you may want to include, much of which we can supply. So I'll conclude here again talking about Duration Health. We have a preset marine medical kit with many of the prescriptions that I spoke about. And I wanted to offer the group this special here. You can go online and purchase a kit. We have it only set up for 10 days just so that the coupon doesn't end up on all the coupon sites out there. So make sure you take advantage of that in the next week or so. This set of medications, again, what happens is you go online, you purchase the kit, you set up a one-on-one consultation with one of our physicians. We review your medical history. If you're allergic to something, say, we take that out and substitute it with something else. We'll talk about your specific travel plans, and we can expand this kit with over 70 different medications on our formulary and basically make it as comprehensive as you need, depending, again, on your plans and the situation you might run into. So that's what we do. Thanks for listening. Thanks for having me. And yeah, check out Duration Health and let us know how we can help.
Okay, thank you. Okay, so one of the other aspects of, I think your medical care is knowing that you, with confidence, can go into any, a hospital or a doctor, particularly offshore, and not have to spend a fortune. And so that comes around to, health insurance, which most of us have in the States, but it usually doesn't work outside of the States. And Arno is going to talk to us today about international health insurance. Take it away,
Hello,
Arno.
and thanks for having me. My name is Arno Crispiels, and I'm here in not so sunny Southern California. And I have been working with cruisers to provide international health, travel, and evacuation insurance for the last 18 years. And what is it? Well, basically, you've heard about all the drugs that you may need, and you've heard about getting a consult when you're injured and then heading towards shore because something's wrong with you. So when you get there, who's paying the medical bills? And it could be you. And it is absolutely true that medical care outside of America is downright affordable. But it's still not cheap. And so it still might be $10 or $15 or $20,000, depending on what you need done to you. And so that may put a significant dent in the cruising kitty. And so having a way to sort of offset that can be valuable. And the other thing it can really do is if you bring crew on board, it can kind of help you out in terms of liability if your crew were to get injured, especially if they're paid crew, that you don't end up in court over a medical bill. So travel and health insurance gets broken down into basically two groups: short term, which is anything up to a year, and it never covers you at home, and it's designed to be used. It's designed to be used in general in combination with your insurance, because that way, if you are truly, needing follow-up care, they're going to get you home, and they're going to provide you with that follow-up, or you will get that follow-up care with your insurance at home. And so it's really good for accidents, injuries, getting hit with a boom, getting in a car crash, breaking a leg, falling out of a tree, getting some illness that you didn't, plan on getting. And that's what it's very good at. It's not good at treating any of the things that sort of could befall somebody as they're cruising long term. And so for that, what you really want is annually renewable long-term insurance. And this can work either, so the way it works is it is literally just like the insurance that you have probably had here in the States your entire life. Some of the same companies like Cigna and Blue Cross Blue Shield under the name of GeoBlue, they offer these long-term plans. And then there's other companies as well. I really like some of the English companies, the British companies. And all of these plans generally have the option to cover you both inside the US and out if you desire. It is, of course, more expensive to include US coverage. And they'll cover you for accidents and illness, just like the short-term medical, but they would also cover something like cancer, or if you develop diabetes, or if something, bad happened to you. They're not going to drop you just because of that diagnosis. They're going to keep you covered year in and year out, as long as you keep the plan and as long as you're still eligible, which generally means spending at least 180 days outside the US, and for some plans living on your boat. Pre-existing conditions come up, frequent question, and they're generally never covered. The one exception to that would be GeoBlue. GeoBlue on their short-term plans has excellent pre-existing coverage, and GeoBlue on their long-term plans will cover you if if they accept you, they will then cover your pre-existing conditions. And I haven't had them reject many people. They're of course, the most expensive. So the way I have this set up, and I'll go pretty quickly, is basically I have this set up as, who are you? Does this model fit you? So here we have Leah and John, a couple under Medicare age, going on the Salty Dog Rally to the Bahamas. They're bringing some friends along with them, and they're not planning on going full time. They're going for this rally. They're going to spend the winter. They're going to come back. That's a perfect travel medical candidate. What does that cost? My prices need to be updated. This is something I put together 2 years ago, but basically this is what it looks like, what it would cost for a month for the couple. You can see Geo Blue, which covers their pre-existing conditions. If they had any, is a little bit more expensive. Atlas is a little bit cheaper. I have other companies as well. And when you ask me for a quote, I send you basically everything that I think will best fit your situation. And then you can decide, what fits the budget. Evacuation is always to the nearest best facility, which is why we have MedJet here to talk about that next, because maybe that's not where you want to go. And typically they try and get you home for further care after you've been treated in a country and if you're stable. And it's great for crew because it reduces your liability. What if you're Medicare age or Canadian and have Canadian health care up there? Well, if you have Medicare, even if you're cruising for a longer period of time, this couple probably would be fine with that same type of travel medical plan, because they know that no matter what happens to them, even with a cancer diagnosis, they can go home and they can get treated. And so, again, a variety of different plans, depending on where you're from and whether you have Medicare or not, are all good. And it's the same stuff as the other plan. What if you don't want to come back? You're done. You're done with America. So Captain Jack and his mermaid, they're retired early. They're cruising full time. They don't want insurance in the US, and they don't want insurance for little stuff. They know little stuff is cheap abroad. They just want stuff for hospitalization, cancer, ER. And there's a variety of companies, Cigna and a company called Expatriate, that offer great plans that just cover those things. So really a bare bones insurance to cover the big stuff. And they know that they're going to get a high deductible and then pay as they go for the small stuff. And that would be the prices I came up with for them. And that would be the price per month for both of them, with depending on how big a deductible they wanted. Most of my clients get a pretty high deductible, 5 or 10,000, and really expect to, hope they never need it. Lots of families are out there cruising now, and a lot of them, they're coming back to visit grandparents. They're coming back for work, and maybe they want to keep insurance in the US. And so those plans are available as well. They're more expensive, but you can see that they're still cheaper than, for a family of 4, that's still cheaper than what I pay here in San Diego. So these plans would all allow you up to 180 days in the US. GeoBlue Navigator will allow you up to 270. So if you're really just cruising a short season, it's perfect. Their one requirement is that you do live on your boat. And I'll let our next presenter talk about evacuation. And there's my contact info at the end of the slide presentation. And I'm licensed here in the state of California.
Okay, thank you very much, Arno. And as Arno said, there are times when you do need to get home fast, and that's when looking at services like MedJet is maybe your best option. So Tom Casey is going to talk about that.
Good afternoon. Oh, wait a minute. Hold on, I had a. Can you see this?
Not right now. We saw it before, but I think you had to put it into slideshow mode.
I'm sorry. Why is it not working now? My apologies.
What is it showing you?
Hold on, there we go. Can you see it now?
Not yet.
We did it earlier. Hmm.
There we go.
Okay. All right. Do you see
Just-
the cover?
Yeah, you just need to click on slideshow.
Yeah, it's not coming up.
Down in the lower right, there's a little button immediately to the left of the size slider, at the lower right of your window.
Okay.
Lower, yeah, then to the right, it's the icon all the way to the right. There it is. Yep, that one.
My apologies. I don't know why it switched formats. So, yeah. So we're here. MedJet is, what we do is we get people to the hospital. More or less, like Arno said, most of your travel insurance or basic insurance will get you to the nearest hospital. What MedJet does is we get you back home. 30 trips and a medical emergency and safety concerns. Duty of care is a growing concern for travel advisors, making sure a client is fully prepared in a medical and security crisis event. So our core product, just to get into it, is our MedJet Assist. Outside of 150 miles of your home, your permanent address, we will get you from hospital to hospital, domestically or globally. This is our core product that we deal with. We also transport for mortal remains as well. The key to us is we're not insurance, we're a membership. So there are no monetary limits on our transportations, no health questions for people under 75 years of age, no claims forms, co-pays or deductibles. We also were big with COVID-19 and we still will help transport people with COVID-19 with the assistance of an on-call doctor. Why MedJet? Like I said, we're a membership, so there's no acceptable facility clauses, no medical necessity transport clauses, no hard triggers. As long as you pay your membership, we'll get you back home. The ideal is, especially if you're overseas internationally, you break a leg, you don't want to be serviced there. You want to come home to your own orthopedist, and that's kind of where we come in. So as soon as an incident involves, you contact us. We work directly with the on-call doctor to check to make sure that you're stable for transportation. And then we also look at the possible ways to transfer you. Do we need like the medical Lear 6 to come out with a staff? Are you okay to get onto a commercial plane with a nurse assisting you along the way? And we also do allow one travel partner to come with you. Just to give you an idea, this is quite costly domestically or internationally. This is just a kind of an example of some of the costs just to transport hospital to hospital overseas and domestically. So overseas, it gets quite pricey, typically over $100,000. Locally, it's closer to $30,000. So I know we'll send you slides so you have this information with you. In addition to our core product, which is MedJet Assist, we offer what's called MedJet Horizon. This is travel security. Also offer some grand ambulance transfer, some specialty hospital transfer, cash advance. But the core idea of the MedJet product is travel security. You're going to Latin America. What this is more or less a travel security 24/7 hotline with an on-call staff that works with, the biggest thing is ransom, blackmail. They'll walk you through the process. If needed, they'll get the local authorities involved and even come get you. So it's a nice peace of mind to have. It's a little bit, it's always included with our core product, so it's in combination with the two. This is, like I said, I won't get into all the pricing, but what we do offer is for our services, we have an annual one that's discounted through the Salty Dog. We also do short-term short-term policies as well. It's 8 days, 15 days, 21 days, or 30 days. We also have expat for people who spend 180 days overseas or even a year. Diamond is for individuals 75 to 84. We do require that they fill out a form. And then also through AARP, we have 84 and above, but it's only international. Like I said, Horizon is an upgrade to our core product. And give you an idea, family, we cover a family of 5 up to the age of 19 or 23 if they're in college. Like I said, one of the greatest things is just peace of mind to have this. The biggest thing is, we don't deny people as long as their membership is paid. So, once you call that physician, once you give us a call, we work with the physician and we look for the best way to transfer you back home. These are some, accolades that we've had. And like I said, we're kind of, I'm newer here with MedJet. We've been with Salty Dog for quite some time as a, as a partner, and we do have a discount with them, and I have it right here. So I apologize for the beginning, but hopefully I tied it up pretty good here in less than 10 minutes.
Okay, thank you very much. Okay, why don't you stop your screen share and we can go back to the questions. So if you have any questions, please put them in the chat box. I'm going to start from the top. The first one I have is for GW. So with now that a lot of our boats have access to Starlink and a much higher bandwidth, do you prefer we use the phone and video or email to communicate with the call center?
Really depends on the circumstance, actually. This is sometimes it's a hard decision for someone to make, but often when we get an initial email, we can review the case and determine whether we need to have a phone call. But truthfully, we like to say that we're communication method agnostic. So we really don't have a preference. A lot of follow-ups, even if there's an initial call, will be done via email because we're just passing information across, but there's really no preference. What we certainly wouldn't want anybody to email us in a true emergency situation. Okay.
There was kind of a question about the cost, and I know there's a Salty Dog. You want to just talk a little bit about?
Yeah, sure. I will say that our pricing is based on a lot of factors: the number of people on board, how long coverage is needed, how far offshore they may be. So it is somewhat individualized. We are offering discounts to Salty Dog members, but without. So members will be covered on the rally, but then for individual coverage aside, I would just ask people to email us and let us know what your specific needs are, and we can put that together for you.
Okay. And the next question, I asked a lot of questions, I guess. So this one was for Dr. Jack. And this is about possibility of keeping Paxlovid on board for the next time somebody gets COVID.
Yeah,
Since-
it's a great question. We're looking into Paxlovid. It only recently came off the emergency use authorization. And so there were some issues around acquiring it while it was still under the EUA. And it's also very expensive on a cash basis. So all of our medications, you're paying cash for, you use your credit card and you buy the kit, and it covers the doctor visit, it covers the physical medications, everything's included in the price. If we were to include Paxlovid in the same way, it'd be over $1,000 just for the Paxlovid.
Mhm.
So we're exploring, are there other ways to make that happen? But for now, no, we do not include Paxlovid.
Okay. And then my other question was about Stugeron, which wasn't in your list of seasickness medications, but some of us swear by it.
Yeah, it's not, it's something maybe we should look into. It's not currently on our formulary.
Mhm.
It's in the same category of medications as Dramamine. And I'm sure people have different experiences with one or the other. We'll typically rely on Zofran, which works by a completely different mechanism of action. And we find that usually works pretty well. So, you may beg to differ. That's where we
No, that's okay. I think it also may be, if it worked for you once, then it's you swear by it.
yeah.
Even though I did look up the formulary and I understood that it was very similar to Dramamine. But-
It's,
Or, yeah.
if I may say, because
Yeah.
do you mind, Dr.
Sure.
Jack, if I
I
mention?
was
So
just
it's,
gonna throw it over to you. I'm sure you'd have more to add on that.
yeah, so it's Cenerazine, and it's an antihistamine, and I have heard very good reviews. However, it's not approved in the United States or Canada, and there are some very specific short and long-term side effects with it. One of which is that overuse can cause people to develop Parkinson's-like syndrome. And I think one of the reasons that it's not approved in the United States and certainly not an over-the-counter is that it can have pretty grave side effects if it's misused or overused.
Okay.
Yeah.
I haven't seen it in the wild. I'm not very familiar with the drug itself. So I don't know. I guess that's why, because it's not approved in the US. So, yeah.
Okay. And then my last question was about expiration dates on the medications in the pack.
So everything in the pack has at least a year expiration date on it. That's the maximum by pharmacy regulation that you can put on a vial. Once your name goes in the vial, it'll be a year expiration date. There's debate as to whether you can get a little bit longer life out of them. We recommend renewing it every year. We'll reach out to you to renew it and coordinate that process, and that way you're never left guessing whether you have a medication that's good to use or not. You can have something fresh.
Okay. So if, what happens if you do have drugs that are kind of expired and that's all you got? I mean, do they still work? Or I mean, I don't want to put you in a awkward position, but
No, sure. I mean, it's something that could certainly come up with this group. Most of the time, those medications will work just fine. There are some pretty good studies showing that the shelf life is longer than is necessarily indicated on the bottle. But the analogy that I sometimes use is like a fine wine that you don't really know until you open the bottle and try to go and drink it or use it, so to speak, as to exactly what the state of what's inside the bottle is going to be. And especially if you are out at sea in a harsh environment, those medications are going to age faster, and there's no way to say exactly how they will age. So we always recommend just, renewing them and not trying to guess at whether something is good to use or not.
Okay, great. And there were some other comments about places where you could get the drug in St. Martin and Antigua, which is where I got ours. And then we had one last person who did say that Zofran works really well and fast. So there we go. We have both sides of the debate here. Okay, excellent. Does anybody else have any other questions? No? Oh, here we go. Okay, people want your links, so we'll make sure we get that information out. Well, if there aren't any other questions, then we'll wrap this up. This will be recorded and available probably by tomorrow morning. And I'd like to thank all of our sponsors and speakers for joining us this evening. And thanks everyone for joining. I'll stop the recording now.